Hi everybody, it's Dr. Phillip Snell at FixYourOwnBack.com once again. It's been a while since I've talked to most of you. It's currently spring here in Portland, Oregon, and in this part of the world that means people are starting to get out and train for the Portland Marathon coming up in October, and they're starting to train for the Hood to Coast Relay Race in August. And as a result, I start to see in my practice quite a sharp increase in the number of lower extremity running related injuries, injuries to the hip, injuries to the knee, and injuries to the foot and lower leg. So I wanted to spend just a few moments today to talk a little bit about the connection between those areas and what you can do to try to help prevent those on your own, and if you do have injuries there, what you can do to help fix them. I see a lot of problems in people that go out and try to run after they've been sitting in a chair for most of the day. The body will tend to try to accommodate to any container that you pour it into most frequently. So for those of us that spend a good bit of our day in chairs or in sitting positions, that causes the body to get the cues that the hip flexors here that help to pick up your legs should be shorter. As a result, when we stand up, we don't completely extend in the hip. Now, why is that important? Well, on the back side of the hip are the hip extensors, your butt muscles, your glutes. And if the muscles on one side of a joint are tight, then the muscles on the opposite side of a joint can't function fully and quickly. And that has a great number of consequences when we take this hip and leg out onto the running trail and try to make it work a little bit better. A neurophysiologist by the name of Charles Sherrington won a Nobel Prize in medicine in 1932 for figuring out the law of reciprocal innervation, which briefly stated means that if you have muscles on one side of a joint, say my biceps here, shortening, then on the other side of the joint, the triceps muscle will lengthen to allow that motion to occur about the joint. Now that's germane to what we're talking about here with the lower extremity and the hip, because when we have runners that sit for a good bit of their day and then go out and start running in a relatively unfamiliar activity, you're going to wind up with that hip flexor shortening that we talked about. If you take a closer look right here, here is a close-up picture of the abdominal cavity, and here we have the spine. This is basically all your guts removed in your abdominal cavity, and you're looking at the front side of the spine here. Adjacent to the spine and attached to it here in the lumbar area are all of the hip flexors, the psoas minor, psoas major, and the iliacus muscle. They go down and attach to the upper inside part of the thigh bone here. Now, when they shorten because a person sits for a good bit of the day, then over here on the back side of the joint, the hip extensors, the gluteal muscles, don't work so well. So we all wind up with butts that are great for cushions, but don't do a whole lot to try to get us down the running trail. Now, if you look closely here, you can see the fiber orientation on the gluteal muscles are somewhat oblique like this. So you can imagine that they're going to both extend or pull the leg back and also rotate the foot externally out. Okay? So if they're not working, the foot's going to tend to track towards the middle, the knee's going to tend to fall towards midline, and that's going to look a little bit like this. When that person with the inhibited gluteal muscles, because of the tight hip flexors, tries to squat and rise, their knees will fall towards midline, towards the middle. You see that all the time in people getting up and down out of chairs. Their knees collapse towards the middle. That's not a good knee position. The knee was made to be a hinge joint. So when it falls towards the midline like this, we run risk of injury. If that happens fast, say in a cutting move like this in a soccer player, that causes an ACL tear. If it happens slowly and repetitively in a long distance runner, it causes patellofemoral tracking disorder as the kneecap is pulled obliquely across the front side of the knee. So we want to try to keep the knee working straight up and down underneath the hips and over the ankles. So we need good functioning glutes in order to do that. And that means we have to push the knees out in order to keep the knee tracking in order to keep the hips working so the knees can track well. So there's a real quick explanation of how the hip and the knee are somewhat connected. There's more information there about how the ankle either supports that whole platform or not. We'll talk about that in a bit. But I think for the next installment here after this, we'll talk a little bit about specific exercises that you can do as well as that ankle issue. Again, I'm Dr. Phillip Snell, and this is FixYourOwnBack.com. As I was editing this today, one of the things I realized that I forgot to mention was that sometimes that hip pain can be not necessarily from just tight muscles from the poor biomechanics that we talked about. Sometimes that hip pain can be because of radicular symptoms. That means a problem with the nerves up in the small of the back or the low part of your back. That's why it's important before you just start embarking on some of these exercises and stuff, assuming that they're going to make you feel better, that you need to contact your doctor or your spine care specialist first. So go and do that and see if the exercises are okay for you. Take care.